Ready? 3, 2, 1.
We are the Leicestershire Partnership NHS Trust Research and Development Team, and we are based here at Swidland House on London Road, south of Leicester City Centre.
We've been here since 2015 and we've conducted research within 3 clinical directorates in LPT. This research includes dementia, Huntington's disease, cardiovascular, stroke and mental health, including other areas of research. We also facilitate research within care homes. We operate out of Swidland House and the surrounding areas, which includes hospitals and participants' homes. This lab is a welcome addition to the building. As you can see from the displays, these freezers get very cold. They're monitored externally 24 hours a day due to the sensitive contents within. These freezers were used to store samples from the Siren study, which provided valuable evidence in immunity following the SARS-CoV-2 infection and COVID-19 vaccinations. The clinic is used regularly for the Enroll HD study, the world's largest observational study for Huntington's disease families. Enroll HD is a resource for the entire HD community, and LPT is the only site in the East Midlands running this study. Our interview room is soundproofed, which is excellent for research participants with Huntington's disease or autistic people, as it enables them to take part in research with minimal distractions.
The team is made up of 2 integrated parts. The research office is funded by the Trust and is part of the regulatory system for research in the NHS. The research delivery team is funded by the National Institute for Health and Care Research Clinical Research Network, whose main remit is to help deliver the high-quality portfolio studies brought into the Trust. Research is important to the health and wealth of the nation. The creation of the National Institute for Health and Care Research Clinical Research Networks themselves were driven by the need to improve research evidence by conducting bigger, better and more robust research. We have carried out studies across all of the clinical directorates in LPT which have positively impacted services. In the Directorate of Mental Health, we carried out the FreeCog study, which developed a free-to-use test of cognitive decline. In our Families, Young People and Children's Directorate, we were part of the AQUA trial, which refined the QB test, which reduces the number of appointments to get a firm diagnosis of ADHD. And in our Community Health Services, we have been conducting the RAPID-1 trial, which tests a novel hematogel for the treatment of diabetic foot ulcers. It is part of our vision to ensure that all staff, patients, service users and carers have the maximum opportunity to be part of research, and to ensure that patient and public involvement is at the core of this to make sure that questions are appropriately prioritised and meaningful. To support the R&D team in embedding research across the Trust, we need staff across all services to help the team deliver the portfolio research that we bring to the organisation. We will also help people to design their own research and for them to engage in some of the opportunities we have available, such as the Research Envoy scheme. After all, today's research can be tomorrow's treatment, and tomorrow's treatment can offer the hope of better health and well-being for all.
We in Leicestershire Partnership NHS Trust are very passionate about providing high-quality clinical services. Clinical research and good quality clinical services are essentially 2 sides of the same coin. And there is enough evidence that trusts that provide clinical research often are the trusts that also provide the best outcomes for their patients. We provide opportunities for clinicians to take part in research, but also opportunities for patients, for carers and staff to participate in clinical research. Research is core NHS business and is in keeping with the Trust principles of Step Up to Great, which is essentially about providing high quality research and outcomes for the patients and carers.
If you'd like to find out more, you can visit our website Follow us on Twitter at LPT Research or email us at lpt.research@nhs.net.